If you've been sending out public health job applications and are hearing nothing back, or if you're feeling stuck in your career, you're probably making one of these major mistakes, and I don't want that for you. Public health careers can be tough to navigate, especially in today's climate. But there are key mistakes that hold people back, mistakes that I've seen over and over again. But the good news is you can avoid these. In this video, I'm breaking down the top 5 biggest career mistakes and exactly what you can do to fix them. Now let's get into it. Mistake number 1, not tailoring your resume and cover letter. Applying to public health jobs with the same generic resume and cover letter. Listen, I get it. It's easier to just send out the same resume, same document over and over. But here's the thing. Hiring managers can tell when you didn't put in effort to tailor your application to that specific role. For example, if you're applying to both a health policy analyst role and a community health educator role with the same resume, that's a big problem. These jobs require vastly different skill sets, different experiences, and allow you to tell different aspects of your career and expertise to show your impact for this role. So here's what you do. Before applying, read the job description carefully. Identify the keywords and required skills, and make sure your resume reflects those. And for your cover letter, don't just restate your resume. Tell a story that connects your experiences to the organization's mission. Talk about how you have added value to your company and the impact that has been done through the work that you have shared. This one change alone will boost your chances of landing interviews. Join our community and come to the free resume and cover letter reviews on February the 23rd, 6 to 7:30 p.m. Mistake number 2, overlooking networking and relationship building. Here's the reality. Most public health jobs are filled through connections before they even get posted. If you're just submitting applications without building relationships in the field, you're missing out on hidden opportunities. So what can you do? First, start networking strategically. Reach out to professionals on LinkedIn. If there's a job you're interested in, find someone who works there and ask for an informational chat. Join public health communities, attend conferences, and get involved in your community. Networking isn't just about getting a job. It's about building relationships that open doors down the road. It's about being known for something in the field. It's about your name coming up in room and someone saying, yes, they're the person that can do that very well. Trust me, every major career move I've made has been because of the people I've been connected with. And most of the paid opportunities that have come to the public health Millennial has been through networking and building my brand. Mistake number 3, thinking that your degree alone is enough to land a job. I know you've worked hard for that MPH or your public health degree, but employers don't just want education, they want skills and experiences. Think about it. Can you analyze data, communicate findings to different audiences, manage projects? Employers want to see that you have practical abilities to do the job. For example, if you're applying to an epidemiology role, employers will want to see that you can work with data. So do you have experience with Excel, R, SAS, or GIS? If you're applying for health communications, do you have examples of creating engaging content or projects that you can share? If you're missing skills, don't stress. Start learning now. There are free and affordable courses online that can help you get experiences before you even land your first job. It's essential to think through, what are the skills that I need to gain right now to put me in the position to be a strong candidate for the job that I want to apply for in the next year, 2 years, or 3 years? So do your research and find out what are the skills and experiences that you need, and then work backwards to gain those skills. Mistake number 4, failing to articulate your impact on your resume, in interviews, or on your LinkedIn profile. A lot of people list job duties instead of the achievements you've made, and that's not what gets you hired. For example, instead of saying manage a community health program, say led a community health program that increased vaccination rates by 20% in 6 months for X population. You see the difference? Employers just don't want to know what you did. They want to know how well you did it and what changed because of your work. Use numbers, percentages, and real examples whenever you can. You want to highlight the tangible impacts that you've had in your work. This one shift will make your resume stand out and give you stronger answers and stories that you can share in interviews. The last big mistake, not keeping up with public health trends. The field is always evolving, especially as we can see now. And if you're not staying updated, you might be missing out on new opportunities. For example, right now, fields like hospitality, technology, and AI in public health are growing fast. If you're only looking at traditional roles, you might not even know these career paths exist. So stay ahead by following public health news, joining professional groups, reading industry reports, and staying informed on the news. The more informed you are, the more competitive you'll be in the job market, and the better conversations that you can have throughout interview processes and as you're building your network. All right, we've covered a lot. I want to hear from you. Which of these mistakes do you think is most common? Drop a comment below. And if you want to take public health career to the next level, check out my other videos for more career advice. And if this video is helpful, make sure to like, subscribe, and share it with someone who needs it. Your public health dream job is out there. Avoid these mistakes, take action, and you'll get there. Join our community, join our free community below, and share this with someone that gets some value with it. There's a problem with news and bias. Staying informed about public health and other health-related topics is harder than ever. Depending on where you get your news, you might not even hear about critical stories, or you might only get one side of the narrative. Take this recent case. A federal judge temporarily blocked plans that would have cut billions in research funding. But here's the catch. Right-leaning outlets might frame this as an attack on cost-cutting, while left-leaning outlets emphasize the dangers of slashing health research. Some media barely covers it at all. That's why I use Ground News. Ground News is an app and website that lets you see how different media outlets cover the same story, helping you cut through the bias and get the full picture of the issue. Compare coverage across thousands of news sources, see each outlet's political bias and reliability, discover who owns the media you're reading, and use the blind spot feature to find stories underreported by one side of the spectrum. I've been using Ground News to track important public health stories and to avoid falling into one-sided narratives. It helps me to think critically about what's being exaggerated, sensationalized, or ignored. Ground News is offering 40% off its Vantage plan. If you click the link below, you can go to Ground News and get 40% off their Vantage plan, which is the one that I use. Your subscription not only keeps you informed, but it also supports making the media landscape more transparent. Check out news today and stay fully informed. Click the link in the bio below. Thank you all so much for tuning into this first solo episode. If there are other topics that you want me to cover or you want to hear my thoughts on something, feel free to let me know in the comments below or drop it in the form that is below as well. Thank you all so much. If you're looking for one-on-one coaching to take your public health career to the next level, I do have some slots below for some paid one-on-one coaching. Feel free to check those out while they last. And see you all next week. Peace.